There are so many misconceptions about what is normal with the female body. A little bit of it is based in fact, a lot of it is just myths and old wives' tales that are just perpetuated in our school education systems, in social media, and just in our culture. So today I wanted to debunk some of these myths and tell you the truth about the female body. So believe it or not, right from the very beginning, people have thought that there was something wrong with the female body if they were unhealthy. There's something called the wandering womb, which is a concept that they believed in ancient Greece and Egypt, where they thought that if you were sick, if you were unwell, it was because your uterus was literally wandering around your body looking for sex or pregnancy. So they would actually prescribe having sex or getting pregnant to treat all of the things that were wrong with your health. We don't actually think that anymore, but we do sometimes tell people, well, maybe if you are having pelvic pain or period pain, you should get pregnant, see if that fixes that. That is obviously not true. So all of these are absolutely myths. A lot of people think that the word vagina covers all of the female reproductive parts. That's obviously not true. So the vagina is only the internal canal. The outside is called the vulva, and that includes things like the clitoris, the labia minora and majora, and the mons pubis. And so when you say the word vagina, make sure you're talking about the actual vagina. So technically, the term virgin is actually a cultural concept and not a biological one. A lot of people will say that you can tell, either a doctor or a partner would be able to tell if someone is a virgin and if they never had sex before. They may be talking about the hymen, which is a little band of tissue which is at the opening of the vagina, which can be broken when you have sex for the first time. But people can have the hymen that's broken by things like using tampons or exercising. The way that the hymen looks doesn't actually say anything about whether you've been sexually active or not. So there's definitely no way for someone to look at you, either a partner or a doctor, and say for sure if you've been sexually active. So female arousal includes a lot of different things. Lubrication is definitely one of them, but also things like engorgement of the genitals and feeling like you are ready for sex physically and emotionally. So if someone is not lubricated enough, that doesn't necessarily mean that they are not aroused enough. There are definitely medical things that can impact lubrication. So you may see on social media the myth that you can tell how many partners someone has had based on how loose their vagina is, or that someone who has had a lot of partners has more looseness of the vagina. That is absolutely not correct. I like to say the vagina is not taking attendance. There's no way to tell how many partners someone has had just by how loose or tight someone is. That is actually more to do with the muscles of the pelvis. So the vagina is actually, the walls are collapsed down. There's really no width to it until you put something into it. What you feel as tightness or looseness is actually more to do oftentimes with the muscles around it. There are muscles in the pelvis, and what you're feeling is usually muscle tone. But in general, being sexually active, number of partners has absolutely nothing to do with how loose or tight someone's vagina is. Another misconception is that labia should look a certain way, a certain length, a certain color, and this is absolutely not true. It is as individual as every human being's own appearance in every other way. Now, there are some times where people feel like their labia are so long that they are catching on clothing or with sex or in underwear and it's painful. That's different. If you feel like the labia is actually causing you pain or symptoms, definitely see your gynecologist. This is one that actually is true. It is possible for your uterus and your other pelvic organs, like your bladder or your rectum, to fall. And that is called pelvic organ prolapse. And it happens most often when someone has had pregnancies, had babies vaginally, and or has gone through menopause, because all of those things can weaken the support structures that normally hold the uterus and the other organs in place. It is possible to have the uterus actually fall out of the body and be visible outside. Now, that is pretty rare. It is more common to have it just be in the vagina. But if you are having any symptoms, like you feel pressure in the vagina, you feel like you're sitting on a ball, or you're having pain with sex, that's something to see your gynecologist about so they can do an exam and check to see if you have any signs of prolapse. There is an entire industry of feminine care products that's designed to make vaginas smell a certain way, like flowers or fruits and things like that. Every gynecologist will tell you you don't need any of those products because the way that the vagina smells is natural. The way your discharge smells is natural. Now, if you are having a really foul or strong odor, it smells really, really fishy, or you're having a lot of discharge, that is something to see your gynecologist about. So thanks for joining us. I really hope that this helped to dispel some really terrible myths you may have heard about the female anatomy. If you have any questions, just definitely leave them in the comments. And if you are wanting to learn more about women's sexual and reproductive health, make sure that you subscribe to our channel. Bye.